Hi there, I'm Sylvia Bukayer. I'm the Health Services Lead at LiveWork Studio, and I'm here to talk about the work that we're doing with the NHS on virtual wards and virtual hospitals. It really all begins with the patient. We know that when patients are at home, they can be cared for in a place that's more comfortable and ultimately safer. For many people, a hospital stay isn't simply time away from home or family and loved ones, but it's also a period that contains risk. It could be risk of physical decline or falling, or emotional and psychological distress, or even disorientation or confusion. For example, consider Richard, who's a 93-year-old man. He's frail, he's got a cough, and he's recently had a hospitalization that triggered delirium for weeks. This was a result of his dementia. So the idea of being admitted into the hospital again so soon was quite terrifying for both Richard and his wife, Maya, who cares for him. So instead, he was able to be cared for on a virtual ward, and he received the treatment he needed. He recovered quickly and safely, and he was able to avoid that stress and that risk altogether. We've been working with Medway Foundation Trust in the NHS, which has a large general hospital. At that hospital, it costs £675 per night to care for a patient. Compare that to their virtual smart hospital, where it only costs £226 per night. A virtual hospital delivers acute care at 40% of the cost of a hospital bed. Medway and Swale's virtual ward is already delivering great patient experiences, effective clinical outcomes, several key metrics such as reduced 30-day readmissions, and it's quite cost effective already. And they're doing this under difficult conditions, right? They have tight budgets, they have staff shortages, they're managing the creation and design of a brand new service with a lot of stakeholder complexity and clinical risk, on top of doing their existing jobs and maintaining the services that they're already providing and delivering great clinical care to their patients. The bottom line is that there's no clear national clinical or operational blueprint for virtual wards or virtual hospitals. And so Medway has been laying the groundwork for this themselves and figuring it out as they go, building the plane as they fly. Their ambition is to scale to a 500-bed virtual hospital in Medway. This can help to deliver emergency care, elective care, reduce risk in the hospital, and improve patient experiences. It can also center the patient in the various places or circumstances where they would need to receive care by coordinating with GPs, with prisons, with care homes, and with community level providers. In order to do this effectively, the service requires quality, clinically assured service design to deliver on that potential for families, for staff, for patients, and for the system as a whole. That's where we come in as LiveWork with our patient journey framework, which, as you can see on the screen, is a nested system of basically dynamic and interactive SOPs, which allow us to zoom in and zoom out, viewing the service as a whole, allowing the clinical teams to coordinate with one another, and allowing the teams to design and iterate their clinical pathways in a way that provides clear clinical responsibility and governance, establishing metrics for success, and really providing the staff with the resources they need when they need it so that they can intuitively find things like inclusion, exclusion criteria, obtain consent guidance, referral forms, and so much more. It's also a project management tool that allows them to collaborate on continuous improvement and continuous innovation by identifying opportunities for increased capabilities or for better patient-centric care delivery or for a new metric that should be monitored, and to identify those needs and monitor the progress towards those actions over time. We're using a platform called TheyDo. And when you look at my screen, you'll notice that right here at the top, we've titled this framework Medway Virtual Hospital. That is because We have the most abstracted view, this what we call level 0, representing not just their virtual ward, but actually all of the services that are or someday will be part of a virtual hospital vision that centers a patient and all of the care services and care transitions that they may go through, regardless of their acuity of care, meeting them where they are and delivering the care in the place that's safest and most appropriate for them. If I click on the level 1 here, I will see Medway's Smart Ward. That is their acute virtual ward service, which and their vision is to have a 500 bed capacity in this virtual ward. So you can see that it aligns to the patient journey at the top. It starts with becoming ill. It then goes through receiving care and, of course, improving or declining as a part of that care. We have the steps of the patient journey in their own language, as well as the service narrative that the team will understand as what phase of the service they are providing. Listed in here is where we get into all of the details, right? So if you think of this framework, this patient journey framework as a Russian doll, you might think of the holistic virtual hospital as that biggest doll. We then stepped into a service, which is one layer in. And now we've got L2, which are these integrated care journeys. And that could be step up, step down, escalation, discharge. And of course, it includes care provision on the smart ward itself. For now, for example, I'll click into stepping up to SMART from the hospital attendance area. So when I click into here, I can start to see, again, the patient journey and service narrative that will always be at the top, but a lot of rich details here that are going to support the staff in doing their jobs effectively and safely and easily. So the first swim lane here is clinical responsibility. So we know from working with Medway that this is essential to get clear and to get right. So we can see at each step of the patient journey of the service experience, who has clinical responsibility for the patient at that point in time. We then have a set of rows or swim lanes, as we call them, to reflect the roles and responsibilities and actions of each of the stakeholders, each of the care teams that are collaborating together in a multidisciplinary way to deliver the care. So in this example, that's the MFT attendance area, the SMART team, the SMART admin team, as well as the pharmacy. If I'm a member of the MFT attendance area, I would know that it's my responsibility to identify patients as eligible for the virtual ward. And to do that, I would need inclusion-exclusion criteria. You'll notice that if I click into this card, I can pop up those inclusion-exclusion criteria just as a quick and easy and intuitive way to get the information I need while I'm doing my job and make sure that everyone's on the same page, and also that these are up to date and accurate, that there's a single source of truth as these evolve over time. If I then take a peek below the MFT attendance area, I can see all of the actions that the SMART virtual ward will be taking. So of course, for the SMART team, they would be using this as well to make sure that they're completing all of the tasks that they need to and using all of the appropriate SOPs and resources. But of course, the nice thing about this is that we can see one another's tasks at the same time. So that really helps with collaboration. Below the roles and responsibilities, there's a dedicated swim lane for those policies and SOPs, so I can browse through and really review everything that's there as it relates to this particular care journey. I can also see the final and most detailed, smallest layer of the interactive SOP of that Russian doll, which are the specific clinical pathways and the alternate care journeys, which will depend on which higher level care journey we're in, of course. But in this case, there's an alternate care journey for patients who might be coming from prison. And so that would be reflected as its own pathway, but really a subset or an alternate version of this higher level pathway. Below that is where we have our opportunities and open questions. And this is really our space for continuous innovation and continuous improvement. So Medway might use this, for example, in their daily huddles when they're reviewing rejected referrals. They might say, hey, why wasn't that patient accepted? Was there anything we could have done differently in the future? Could we build a capability in this area? Could we expand our inclusion criteria in this area? And so forth. And this is a space for them to capture and monitor and own and collaborate on those ongoing improvement and expansion efforts in a way that's quite visible and also links into the rest of their service and to their metrics. At the end of each at the bottom of each integrated care journey, there's also space for metrics, which also exists at the top of each service page for higher level, service level metrics. So this is a tool that helps to monitor those numbers, but it also helps the teams identify what numbers are most pertinent for them to be measuring in the first place, because it's done in a way that's logical and aligned to that journey. Thank you for listening. If you'd like to chat about this, we're always happy to have a conversation, so feel free to reach out.